As you see here, we have the Tri-County Health Improvement Plan that was built in response to our community health needs assessment that we've worked on in 2016 and 2019, and we're about to start that effort again for the 2022 community health needs assessment. What you see here is the 5 top priority areas that are identified in our work plan to get to a healthier community. But we can't begin to work on that plan until we address the social determinant factors, as well as make sure that we build in health equity in all the work recommendations and activities under our Tri-County Health Improvement Plan called Our Health, Our Future. With that, this regional effort is designed to strengthen the local efforts to improve community health by conducting the data collection, as you see here in our health landscape document for the Community Health Needs Assessment Report, encouraging ongoing collaboration through our work group efforts, establishing communication tools together to test performance and as we implement work and strategies across the Tri-County. And then also we're able to offer training and technical assistance to partners who are moving the work efforts in our Tri-County area toward greater health improvement. And then sharing those interventions and promising programs with each other. Next slide. And just wanted you to see the breakdown of the work. It is a structured work where we move together on these different fronts and different activities. We've had many catalytic projects that come out of this work. For instance, one of our major goals under our Diabetes Coalition is to decrease the rates of diabetes through implementing and the expansion of the National Diabetes Prevention Program across the Tri-County, which is a CDC recognized evidence-based program. On the other end of the work, through our Health Improvement Plan work groups under immunizations, for example, during the pandemic, as we tried to move to health improvement during the pandemic, we were able to switch to a virtual platform and offer webinars from within our work group under immunizations, for example. That group came together with both state experts and our local experts and community organizations and businesses that are members of Healthy Tri-County to provide a provider webinar as we saw the rates of immunizations decrease, even greater decrease in those numbers during the pandemic. And so that group and that team came together to offer best practices about how to keep the rates of immunization up within pediatric practices across the Tri-County. And so it was our way, one of the many ways that our work groups and our community partners responded during the pandemic to make sure that we see our way to greater health improvement and also address the health equity concerns that we see that were amplified during the pandemic. To that end, I would love for you to hear from 2 leaders who were very influential in the development of Healthy Tri-County and our core partners in the work, and who continue to fight the health improvement in our region in this pandemic and beyond. I will start with my friend and colleague, Kim Butler-Willis, the Director of Community Health at Roper St. Francis. Kim, I will turn it over to you to share about the activities at Roper St. Francis that are taking place that are driving health improvement in our community and that have been amplified by the pandemic during this time. Kim, over to you.
Thank you, Renee, and thank you, Trident United Way, for hosting this panel. And can I pause to say shout out to the Black Girl Magic? I mean, it's beautiful that I get to have opportunities like this with some of the ladies that I not only call friends, but really look up to in this community health space. So kudos to Trident United Way, and thank you, Renee, for having me. So I am Kim Butler-Willis, Director of Community Health at Roper St. Francis Healthcare, and we developed a new division at the hospital in September 2020, and that is our Office of Diversity, Inclusion, and Health Equity. And within that department sits the Office of Community Health. So as the inaugural Director of Community Health for the healthcare system, I'm using my time to really explain to people what community health means for Roper St. Francis and how it looks in our system and the programs and services that we have that we can now really work to elevate for the community members, those that we serve. So the core objective of this new department is to support partnerships with key organizations addressing economic development and health equity issues such as housing, workforce development, income security, hunger, healthy aging, etc. So anything you can think of when you consider the social determinants of health, that's really our mission in the Office of Community Health, to figure out how, if it's not within the realm or the scope of Roper St. Francis, how do we bring the right partners and players to the table in order to address those needs? Next slide. So who we are, we have differentiating the roles, because as the nonprofit hospital in the region and as a very charitable hospital in the region, we do have some overlap, which has been beautiful as we flesh out what community health means. So you'll see here the three spheres that really intersect most with the work of community health. And we have the diversity and inclusion team, in which we'll have a new leader very soon, cross our fingers, to help guide that work. But that team is there to develop strategies and programming that will foster diversity, inclusivity, and professional development for our teammates. And then we have our mission department, which honestly feels like the grandfather of all that we do. That's led by Mark Dixon. That's our charitable programming and support that aligns with the mission and values of the hospital. So when you think of the work that we do out in the community that's not necessarily tied to a program, a lot of that comes from mission, and that's based in the Catholic teachings of our hospital, or the Catholic foundation of our hospital. And then community health. That's us. We coordinate and manage the programs and initiatives that promote healthcare access and equity for our most vulnerable populations. And whenever I say vulnerable or marginalized, our priority populations in relation to the work that we do in community health, I'm thinking of this acronym that I just made up called RUPOC. So RUPOC, but I'm considering our rural, our uninsured, and our people of color. Those are our three primary populations when we consider the work that we do. Next slide. So what do we do? I've said that like 15 times. All that we do. Well, we do a whole lot. And you may even recognize some of these programs. So Access Health Tri-County Network, one of the larger programs under community health, because not only do they care for the patients of Roper St. Francis, but they care for patients in all 4 of the hospitals in our region. And it's a small team that's doing it. This team was formerly led by Renee Linyard-Gary and now is led by Rashima McKelvey. But again, a small but mighty team serving as brokers to connect uninsured folks to primary care and specialty care when they otherwise would not have been able to receive it. So kudos to the Access Health team. We also have community outreach. Anytime you see Roper St. Francis at a health fair, hosting a COVID drive, providing any type of health education, our hands, talent treasures, our time to the community, that's generally funneling through our community outreach efforts, our community investments as well, and then our community benefit reporting is what you'll see. We have some new budding relationships with Boeing to determine how we can encourage more people of color, rural folks, and again, people that are coming from vulnerable communities. How do we pipeline them into STEM occupations that could be either at Boeing or Roper St. Francis? And we're also trying to find creative ways that we can reduce opioid use in the community and even addressing human trafficking. Third, we have the Greer Transitions Clinic. This is the clinic that you see out on Rivers Avenue. This is our subsidized clinic for those who are uninsured or frequent users of the ED. This is our stabilization center. We want to get you here so we can take good care of you and get you in good health and find you that permanent primary care medical home. But I will tell you this, because Greer Transitions has really grown to become such a jewel for that underserved community, we've started to let the patients stay. So we haven't been sending them to those permanent primary care medical care homes because they feel so warm and welcomed at the Transitions Clinic. Again, that's led by Amanda Biondi, and she's done an amazing job trying to incorporate or co-locate those wraparound services that we know that the community often needs but have little access to, like a shower, a clothing closet, and even access to mental health and social work services. So shout out to the Transitions team. And they also are responsible for our system's COVID testing. So anyone who's coming into the hospital system for a procedure will have to go through Transitions Clinic. So please let those ladies know how much you appreciate them. Fourth, we have the Ryan White Wellness Center, and this is where my office sits. These are These are my babies. I've been at Ryan White since 2014 before transitioning into this larger role, but nonetheless still share time and space at Ryan White. It's a comprehensive sexual health center, and it's the only sexual health center at Roper St. Francis. We have done a great job of co-locating, again, like Greer, some of those services that we know that patients need most, like dental, vision, pharmacy, mental health, and even a clothing and food pantry. So anyone who is living with HIV or in need of sexual health treatment or screening, please have them contact the Ryan White Wellness Center for that free or very, very low cost care. And then lastly, but certainly not least, we have senior services. And senior services encompasses our 2 senior centers, one on James Island, which is the Low Country Senior Center. And then in West Ashley, we have the Waring Senior Center, which is the newer of the 2. And it's the beautiful picture that you see below. Both senior centers, as you can imagine, were hit dramatically, significantly during the COVID year last year, just because of the people that they serve. But lo and behold, senior services at Roper St. Francis is not just for our 70 and older, it's actually for 50 and older. So we're going to work on that name because 50 is not seniorly. However, if you are 50 and older and you're looking for a place to work out, to connect with others, or just for some social engagement, please feel free to reach out to our senior services. Not only can you pay your membership to receive benefits to all those services, but we also provide scholarships for those who may not be able to afford it. Another great programming out of senior services are $2 meals. So working with the Low Country Center on Aging, they've been able to provide these well-balanced meals that seniors can sign up for anywhere from $2 to $7 per meal. So if you have seniors in your church, in your communities who you know are food insecure, please contact senior services because they may be there to help. Next slide. And what's most important is the why we do what we do. And I love this quote from Sister Carol Kean, who's the president and CEO of the Catholic Health Association. And clearly you can see from this picture that she's a pretty big deal, not just for us at Roper St. Francis, but across the country. And she said, our organizations were established not for economic opportunity, but to address the need for health services in our communities. Our facilities were born out of community need, a tradition that continues today. And I am so proud that Roper St. Francis gave us the opportunity to put some fire under this quote in developing this new office. And I look forward to working with each and every one of you to determine how we can best provide the optimal care for everyone in our community with compassion, faith, and excellence. Last slide. That was me. Thank you, guys.
Thank you, Kim. And Kim, with just one clarifying point I see in the Q&A here, giving us the name again of the new diversity project at Roper, that new arm, what is it termed?
Yeah, it's the office, it's Diversity, Inclusion, and Health Equity.
Yes,
DIHE.
Yes, ma'am. Thank you, Kim. And I'm so happy to see all the great work that's happening at Roper St. Francis as one of our core partners in Healthy Tri-County, leading the way to health equity in our community for all populations. With that, I'm going to move to our other stronghold partner in this collective effort in South Carolina DHEC, particularly in the Low Country region. With Felicia Veasey and her leadership here in our Low Country region around the health improvement strategies at DHEC in our community, really provided the lead technical assistance to our work at the Tri-County level and has been a valued partner as we move the work in public health and also within our health systems, as well as in our community. So with that, Felicia, I'll turn it over to you to give us an update about the work that's moving. Particularly, I know today is a big day, right, in the state of South Carolina.
Yes, it is.
Around vaccine rollout and distribution. And so I'll turn it over to you to give them, the audience, the key highlights of the happenings around town today.
Thanks, Renee. So let me start with a milestone in our efforts to contain the COVID virus. Today, as Renee mentioned, it's a big milestone for us because South Carolinians ages 16 years of age and older can begin to schedule or receive one of the 3 vaccines available in our state. This phase makes the vaccine available to everyone, and it's because of our incredible efforts of our healthcare workers and our community partners. Next slide, please. Since we last expanded eligibility, DHEC and providers managed to administer an average of 23,323 doses per day, resulting in about 419,816 administered doses since March 8th. The reason why that date is special, or why we highlighted March 8th, is because that was when we started phase 1B, and that was maybe 3 weeks ago. So to date, more than 15% of our population have been fully vaccinated. So we're right at about 16.5% of our population vaccinated, and at least 30.5% of our population have received at least one vaccine or at least one dose. So please note the numbers on this slide changes weekly. This week, South Carolina is receiving 160,770 vaccine doses, including a one-time increase of 15,210 doses of Pfizer vaccine, up to 28,900 doses of Janssen vaccine. Janssen, for those of you who don't know, is also the Johnson & Johnson vaccine. While not listed on this slide, we also continue to receive the Moderna vaccine. And this week, we have received 66,000 doses of Moderna and 31,000 of the Janssen vaccine. That Janssen vaccine has been distributed to our smaller providers. And I want to explain, because I constantly get questions about who can get what vaccine, as we're talking about the new phase for the 16-year-olds. Typically, our healthcare systems, which are hospitals and some pharmacies, receive the Pfizer vaccine, which is for 16 years of age and older. And then DHEC, as well as other providers like our FQHCs, have Moderna. And we're starting to get Janssen, hopefully in the next couple of weeks at the health department. But we primarily, and I know we primarily actually have Moderna, and we're hoping to get Janssen in the next couple of weeks at the health departments. So again, when you're receiving phone calls or starting to ask, where can I go to get, can my 16-year-old come to the health department? We have to say no, because our vaccine is for 18 years of age and older. And so I'm usually directing them to Robert St. Francis or MUSC, or trying to find on the Vax Locator where there's a CVS or Walgreens that actually has the Pfizer vaccine for 16 years of age and older. Recently, Publix was added as a federal pharmacy partner, which means more available vaccines in our state. Pharmacy partners receive a separate federal allocation directly for vaccines. This week, that allocation is about 75,000 doses. And our other federal pharmacies include CVS, Walgreens, and Walmart. This is great news, of course, for our state, as we have expanded to our next phase. More vaccines mean more vaccinated people, and that we are closer to herd immunity. Unfortunately, as recently as last week, many of the available appointments are not being filled. So that's a discussion for later on. But we're starting to see where we're not having as many people fill out the appointments that we have. Next slide. Okay, currently there are about 71 individual providers in our state and 33 vaccine hubs, which represent about 1,022 locations where we can access vaccines. These providers include hospitals, federally qualified health centers, pharmacies, and other health departments across the state. We understand that even with many available appointments, there are people who want to get the vaccine but cannot due to lack of transportation. And the fire alarm is going off in the building that I'm in. I'll keep going, hold on. So there are people who want to get the vaccine and can't do transportation, also because of their different local events. So we also understand that their hesitancy based off of distrust, misinformation, or a lack of education on the importance of getting vaccinated. Next slide, please. So our agency is readjusting our strategy to make sure we are providing access to everyone and continuing to work with community partners to do the following. That's identifying community champions to foster trust and engagement at the local level, educating people on the importance of getting vaccinated, and then ensuring easy, equitable access to vaccines by making the process as simple as possible. In the Low Country, we are depending on our partners as well as access to looking at the access to potential barriers to access vaccines in our community. One of the barriers that we have noticed in our area is the fact that we are requiring folks to go online to schedule appointments. And so that was one of the first things that we saw was an issue, because in some communities, folks do not have access to the internet. And let's be honest, when we first started phase 1A, it was 65 years of age and older as well. And so with that being said, some folks don't know how to use the internet. And so again, we were asking them to make an appointment and they didn't know how to actually do that. So basically started working with our community partners to figure out how to help these individuals schedule appointments where they didn't have to necessarily wait in line for an extended period of time, and also still maintaining social distancing when they came to a site. And so what we decided to do is we actually worked with community partners to include faith-based organizations and so forth to identify individuals who needed assistance with, can y'all hear the alarm? I'm sorry. Is it loud? Okay. So basically we started working with community-based organizations and churches to basically identify individuals in their community, basically where we had them pre-registering per se, and we basically take that list and we contact those individuals to actually schedule them appointments. So we have a line that has been identified to for those individuals to make an appointment. So again, we are working also with Dr. Thaddeus John Bell, Reverend Middleton, and the data group with ADLH Scientific. This group has launched a grassroots digital campaign to convince hesitant African Americans to get their vaccine and to provide access to those who simply cannot. This week, we are working with the Latinx community at our vaccination clinic in North Charleston, thanks to our partnership with the Charleston Hispanic Association. Some of the churches and groups that we have been working with, again, Trident United Way, the Aging County Councils, churches like Royal Baptist Church, we're actually doing a vaccine clinic here today. Other community partners have been the Isaiah Drive Church of Christ, Canaan United Methodist Church, as well as some community workers at the Divine Health Education in Berkeley County. We are fortunate to have wonderful partners in this with as far as healthcare providers is concerned, to include Better Healthcare, MUSC, and Wilbur St. Francis, and other local providers that are providing vaccine clinics in our rural communities. We're also thankful to organizations that host virtual sessions to educate themselves and their clients. Also, as you can see, everything we do is done through a collaborative effort. I want to take this time to thank the United Way and all of you on this call who continue to provide care during the pandemic and for support in our efforts.
Thank you very much, Felicia. That was quite dedication to sit through a fire alarm. I was watching for smoke in the back. If that had popped up, I would be sending you out of the building, but that's a true dedicated public servant there. We'll go through a fire alarm and continue to present for us. Thank you. We do have a couple questions, and I'd like to pose one. I guess I'll start first with Renee. In the health needs assessment, the community health needs assessment, one of the things, in fact, that was the second highest priority was clinical preventive services, which includes vaccines. Can you talk about how that work prior to the pandemic kind of set the groundwork for things to go a little smoother once the pandemic came?
Great question, Brad. So that work effort, based upon the data that was collected in our community health needs assessment, we could see the gaps and disparities in people and the rates of immunizations, both through the lifespan, from our infants up to our seniors getting vaccinations. So the work plans that were put in place by key leaders from many of the organizations, from Molina to Pfizer to the school districts, all coming together as a collective group to strategize and to work together as members of Healthy Tri-County to develop strategies and special projects to address the concerns that we were seeing in our community around immunizations before the pandemic. The example that we see is that the vaccination in some of our vulnerable populations in the community around school-based care, children who need vaccinations, bringing the vaccinations to their community, to the families, because we know that many of the socioeconomic and social determinant factors that impact these communities where we see the greatest disparities in immunization rates, they have many external factors that shape why the children and families cannot get vaccinated. And so one of the projects of this work group effort was to bring the immunization clinics to the community where there is need and there's a gap in getting access to services. And so strategizing with partners like our MUSC Cares Clinic to deliver that program to the community within the schools that have some of the greatest needs. So that's one example of how we strategized and came together to get to health improvement even during the times of the pandemic. And as I stated before, just offering, when we couldn't get space, offering the virtual learning for providers to talk about how to work around getting their patients vaccinated during the time of the pandemic.
Excellent response. I think as chair of the Community Impact Committee, it's also gives me pride to know that we're doing things with diabetes and prediabetes, because we've seen the mortality rate go up with people that had pre-existing conditions like that. So we were actually ahead of that. And the more we can get on that, if we do have another, heaven forbid, any kind of virus or something go through, we know that we're saving people's lives before they get to that point. I'd like to pose another question for the rest of the group. What has been the unexpected things you've seen in the difference between health in rural and urban settings? And I know Felicia mentioned transportation, which is a continuing rural problem. Has there been anything else that you all noticed, either DHEC or at Roper St. Francis?
Brad, I'll say that one thing that not that we didn't notice it, but we didn't understand the severity of it, was internet access. These internet deserts that we have, because so many people are connected to their cell phones, and it creates a false narrative that everyone's connected, right? When in fact, we know that there are pockets of our state, even in the low country, where they still do not have stable internet access. I live out in Hollywood, and transitioning to a remote job, so working from home or teleworking, wasn't always easy every day. And so it's important that as we move out of COVID, praise God, that we keep some things in place. And that's the consideration, that all people do not have access to stable internet. Even if they do have some connectivity, it may not be enough to function in the way that I see healthcare moving in the future. So how do we get ahead of that proactively so that everyone still has access to high quality healthcare?
I just want to add into what Kim shared in reference to that. Again, because we work in healthcare and we have access to the internet every day, it's a no-brainer that everybody, in our minds, everything is done through the internet. And so again, like we said, we were doing our appointments through the internet. And I want to share a personal story with you guys. For my dad, he went to Feder to get his vaccine. And when I asked, I said, well, hey, Daddy, like, why did you, what made you go to Feder? And he said, Felicia, I don't know how to use the internet. I don't know how to get on that thing and to navigate. And that was like a aha moment for me, because here I'm overseeing COVID operations and I'm entering things every day, but I missed my dad's scheduling appointment. And so it was one of those moments where I was like, okay, we have to do something for those individuals, one, who don't have the access to the internet, and then also who don't have the knowledge of actually being able to get on their appointment. So those are some of the things that I've seen, transportation as well as the internet issues.
Great point. As a seasoned citizen myself, I notice it's also an age-related thing. I know when I did my vaccination, 65-year-old people in their cars, weaving through a parking lot, running over traffic cones and curbs and everything else. And they tell you to park and face the building, flash the lights, and you go out and 30 cars are parked the wrong way. So age relates to that too. And I think that's something we need to look at. Another question would be, after recovery, and assuming we come back better than we were before, what does that look like for DHEC? What does that look like for Roper St. Francis? What does it look like for Trident United Way in the health area?
Well, I can start that. I think for Trident United Way and our work under health and Healthy Tri-County is to continue the momentum that we've gained. I think we've become stronger in the pandemic. We've become even more collaborative. I mean, for Kim or Felicia to call Healthy Tri-County and say, hey, or to push the information and know that we're going to reach the masses through our network, we have to continue that momentum and build upon the strengths that we've had during this time, so that we can get to health equity even more expeditiously than before. What we have heard from nationally and from many experts is that the health disparities that we all know too well, because the nature of our work, were amplified and accelerated during this time. And so I think we really have to take advantage of the momentum that we've seen in our community and across our state as well. Kim, any insight there?
Yeah, I was trying to be creative and come up with 3 C's. And so I think I got it. It's courtesy, community, and connectivity. I see us really moving at Roper St. Francis with courtesy. Guys, when you come through our COVID lines or when you come through our hospital, those smiles that you see, those are genuine and real. In fact, before staff meetings, during staff meetings, and leadership meetings, we're always talking about that high expectation of courtesy for our patients and for our teammates. And so I hope and pray that when you walk through our doors, you feel that and it feels authentic, because we work really hard at creating a culture in our spaces that is welcoming for all patients. You may have seen our yard signs through the Diversity Council that says, you know, healthcare is a right, love is love, Black lives do matter, because we want to make sure that our allyship is not passive, but that we're actively engaged with our patients and in social, not even social justice movements, but actively engaged in the lives and experiences and the full experiences of our patients and teammates, and that you're clear about which side we're standing on, especially when it comes to healthcare, because it is a life or death issue. With community, for everything that I told you guys about this new office, I mean, we created a whole new division just to focus on the people outside of our walls. So everything about community health is not particularly for Roper St. Francis patients, it's for the general community, regardless of your healthcare provider. So I do a great job. Thank you, Felicia, for shouting out FEDER. They've been an amazing partner through this COVID feat. In fact, my mom went through FEDER as well for her vaccine. And it's nice to be able to speak to these different healthcare neighbors routinely to make sure that we're all working collaboratively and we're not being redundant or wasteful, and being good stewards of those vaccine doses that we're getting in, so we're not overlapping. And then last, I said, is connectivity. Back to the technology. I think COVID has opened a Pandora's box that's going to be hard for us to undo. And there's a certain ease and efficiency and low cost that comes with virtual appointments, and keeping up with the trends and staying connected to your physician, even when not in their office. And so I believe that that's just going to increase, especially as Amazon creates their new tech in healthcare spaces. We're going to have to keep up. And I know that under our new leadership with Dr. Jalisi, that we're going to work very hard to make sure that we remain relevant in this market.
Okay, so same thing for DHEC. My role at DHEC is chronic disease prevention. So again, we started seeing the disparities along the way of how COVID was impacting a particular population. It wasn't a surprise to me. But as far as recovery is concerned, moving forward, we want to make sure that we're continuing to keep our efforts in those communities and not going back to our buildings to do the work. So we want to make sure that we're continuing to keep our work efforts and education in those communities and making sure that we're serving them in the way that we should.
Excellent. Thank you very much. Another question is, as we look at, we're coming due for another health assessment, both for the Tri-County area and for the state. What do you see as how much different will this look from the previous ones? What kind of increases or changes do you see from the state for Felicia, and for Kimberly for the one that Roper St. Francis will do?
Lee, would you like to speak first?
I was actually yielding to you, Felicia, to talk about the state, and then I'll talk about local efforts.
Okay, and so I'm used to, we worked well with Roper St. Francis and have been for some time. In transparent moment, I'm not sure if many of you guys know, but the state model and what we're doing actually came from the model that we have here in Charleston. So they've actually been looking at what we do here in the Charleston Tri-County area, and the fact that we have so many agencies working together on this assessment to then model the state efforts. So with that being said, as far as how assessments are going to be done differently, through this process, we have made different contacts in the community. So I feel like we'll have a more diverse survey group as opposed to how we've had it before, because we typically would send it to our contacts that we have. But in this COVID world, we have made contacts in the rural community, more with churches, like I said. And so we have a more diverse background that we can actually say, like, okay, so here in Onda or here in Hollywood or in this pocket of this area of Alvin, this is what they see as a need. So because we have those contacts with the churches in those community groups, we'll be able to have a broader perspective as to what those needs are. And that will help us going forward in our community health needs assessment, as well as the health improvement plans.
Brad, ditto. I think for everything Felicia said, we are fortunate, and I hope that our partners on the call, they feel this too. But in the Low Country, we're unique in that we are very collaborative and friendly with each other. We really don't compete to care for people, and it's really made our job my job easier. And I think I sometimes take it for granted and expect it as a standard. But when I speak to colleagues in the Midlands or upstate or even in the PD, things don't move that smoothly. And so we really should pat ourselves on the back because we work very hard to make sure that everyone has a seat at the table so that everyone feels represented. And you don't even have to represent an organization. You can represent a community because all people and all brains are welcomed at our table. So thank you guys for all you do.
Excellent. Well, hand in hand with that, Mayor Tecklenburg would like to see a COVID-19 information campaign to focus on Latinx. And they were glad to hear that you do have an outreach program in North Charleston already. What else can be done or is being done locally to reach these communities?
Well, I'll tell you, I'm hot off the press. So Roper St. Francis is working with Hanahan Fire Department to stand up an event. I think we'll have a little over 500 doses specifically for that community. So just got emails this morning that we got dates set. And so hopefully you guys will receive flyers soon. And I know that 500 isn't a whole lot, but it's it's the first stab we have at making sure that at least 500 more Latinx residents are able to get their first and second doses. And I'm sure that more information and opportunities will be on the way, but we do have at least one other event that will be coming down the pipe very soon in April.
And from the state, Felicia?
Yes, and as you mentioned, the event that we have at Ferndale Community Center tomorrow, we also want to continue to have community events in different communities that they're heavily represented. So we are continuing to work with the Hispanic Association, as well as Fernando. Fernando's actually here on site today. They're doing a media campaign where they're basically showing other Latinx residents actually getting the vaccine and speaking about doing the testimonials and actually walking from registration through the entire process so that we can share that with the community so that they know that they can see what's actually happening. But the whole idea is to, again, make them more comfortable with the process as well as putting vaccine clinics in the areas where they feel most comfortable. Because again, we've noticed that people go where they are comfortable and where they feel like they can trust those individuals. And so that's what we're working towards.
Once again, all this.
Yeah, and
Go
Brad,
ahead,
may I add, if we have anyone on the line who has contacts in that community, please share with me, please share with Felicia and even Renee. That's honestly a community that I believe we could do more work in. And because we don't represent, we're not a member of that community, it can sometimes be harder to get into the community. And they also have some other social barriers that we recognize and acknowledge are real, fear of just engaging with healthcare due to other immigration status or even just generational messages about healthcare and working with the government. So if you are a trusted partner in the Latinx community, please reach out to us because we want to make sure that we have opportunities and educational resources specifically for our Hispanic Latinx community members.
And I think if there's, go ahead.
And to that point, Kim, I wanted to add just on Monday afternoon, had those kind of key informant conversations in the Latinx community with two different stakeholders who run two different arms of the work. So sharing that information back, and when we receive your information here at Healthy Tri-County, to make sure that we're strategizing and approaching the right way in the communities and making sure we're helping build those cultural competencies. That's the only way that we're going to be able to move this vaccination to the masses, by being within the communities and having those shepherds of that work being a part of the conversation here within Healthy Tri-County. And so I just want to highlight the fact that that container for change, really, when you plug in, you get a large coverage area of resources and information with our partners that we do have. So more to come from that. I've had some key takeaways from that, and I'll be more than happy to share with you all and keep my ear to the ground as we hear more from that community on how best to approach.
If there's been a positive from the pandemic, I think it does show that community health is truly a community objective that we all need to work together. None of us live in silos when it comes to health. And so at least that's one thing that hopefully that's opened a lot of people's eyes. One of the cornerstones of community health here in Charleston is Rick Foster, and he posed the question, clearly our greatest challenge, both in general and with our pandemic response, is the major equity gaps in race and geography. What else should leaders in our community be doing to promote and support equity-focused programs and services?
Dr. Foster, you would stump us. I would say, I would say that it is the time that we consider community health outside of community health. So how do we integrate these teachings, these lessons learned, and even the practices into just general health? How do we integrate throughout the healthcare system so that it's not required that we have a lone community health department, but that everyone is focused on disparities within their own specialties? That's something that I would love to see in healthcare within and outside of our walls, meaning inpatient and outpatient. Everyone objectively looking at disparity metrics and working on quality projects to improve healthcare for every one of their patients.
So adding on to what Kim shared, as a leader, and I think naturally as humans, we tend to look to care for those who look like us first. And that's just human nature. But I would hope as healthcare leaders that we're starting to, again, with this pandemic, starting to not look at who's not just who's impacted, but how can we help everyone? So not going into, well, let's start here and then we'll, oh, did we catch this group? But more so saying, okay, who is impacted? Looking at the data truly, and letting the data lead us to where we need to do our efforts as healthcare providers.
Excellent. We've kind of hit our hard stop on questions. We did have Amy Chang from the Charleston County Public Library make a comment about the WISE telehealth network that they've got. And that's an excellent program. They would like to connect with a couple of you offline. So we will make sure, Amy, that that is done. And with that, so we don't cut into the rest of people's lunch hour, I'd like to introduce our CEO, Chloe Knight-Tani. And if you would give us the wrap up, and thank you to all the community partners who have been involved in this. It truly is a community organization, and it does my heart good to see the United Way leading the way on bringing people together for the benefit of the community. Hello?
It's been fantastic. Thank you so much, Brad and Renee and Felicia. My goodness, through a fire alarm, you are here to serve our community. And Kim, we love working with all of you, and I just want to thank you. You've been excellent panelists. You're extraordinary health partners. You're leading, you're sharing your expertise. You're doing it all at the same time. And it is just such a privilege for us at Trident United Way to be your partner and to work with our colleagues at DHEC as well as Roper St. Francis. And I just want to thank our panelists individually, but also institutionally, because you have been here for our community, you have been here with our community, and you have had the most incredible and robust response for our community since the onset of the pandemic. And that does not just happen. That happens when you have committed individuals and experts who understand that the impacts that we are seeing here are longitudinal. This is not a 2-month ordeal, as we all now know. And we'll be experiencing the effects of the pandemic for many months to come. And I also had a thought as you all were sharing just about the work of Healthy Tri-County, and having worked in other pandemic fields before, I was sitting here while you were speaking thinking how grateful I am that we have the plan for a Healthy Tri-County. If we had not had that before the pandemic came to our shores, we could not have created it. And so thank goodness that we have a group of leaders in our community who had the vision that this kind of network and collaboration needed to exist, because when an emergency occurs, is certainly not the time to start trying to map out and determine who your key partners are. So I want to just thank you all for being part of that. And if you are part of an organization that has not signed on to our work for Healthy Tri-County, I hope you will go to our website. I hope you will look at that, because if you aren't part of it, we need you, and our community needs you to be part of those efforts. I'll also just say, and again, listening to the conversation today, absolutely struck by the significance and the impact of partnerships. Certainly highlighted today has been extraordinary over the course of the last year. But local partnerships are imperative. And if you didn't hear anything else today, I hope you heard that, because none of us can do this work alone. And our greatest advantage in terms of how we all improve lives is that we know our local communities. We are all hyper local, and we know our community best, and we work with our local partners to catalyze change for it. This has certainly proven itself to be true and absolutely necessary in the course of the pandemic. We are at Trident United Way certainly remaining committed to the recovery of the Tri-County region as our community continues to emerge from and really begins to heal in many, many ways from the effects of the pandemic. We're staying committed and staying the course in terms of how we lead in health improvement, how we support population and community health, how we strengthen health outcomes, and as an umbrella in all of this, how we champion health equity. And so I just want to say thank you to each of you. I want to thank, we have a group of 75th anniversary sponsors who have helped make this virtual event possible. Again, if you want to learn more about our work in the health arena with our health improvement plan, learn more about Trident United Way, either how to get involved or partner, volunteer, advocate, engage in what I refer to as our traditions of consequential work across this community, then please reach out to us. You can certainly reach to me, you can reach to Renee, you could reach to Caroline Bird, our VP for Advancement. We would welcome your engagement. And now I think we have an added responsibility, because if you were part of today's conversation, you are now part of what I call our interstate system for health in this community. And when I talk about health in this community, I mean the health of all the people, every person in our community. So we invite you to join us in this work. We need you, we need your partnership, we need your thought leadership. So please come alongside and work with us. And I just want to say thank you again. What an extraordinary conversation this was today. So thank you so much to all.
And with that, we will say thank you all very much. Have a wonderful day and great rest of the week. And here's to a healthy Tri-County. Thank you for everything you do. Goodbye.